All right, last before lunch, so you have to pick it up, John. We have John Morris to talk about our tracking, and this is one of the aspects that has been, it became, I guess, official. Last year was our first full year in it, but he'll talk about that. So John's lived in Houston since 1991, but started boating a few years before that. He sailed his first Harvest Moon in 1996 aboard Catch My Drift, which he still owns. He stopped sailing the race a few years ago, but has become a tremendous asset to the regatta due to his knowledge of race technology, logistics, and tracking. He says the most memorable time on the water was his 4-day out of Pensacola in 1995 on his newly acquired boat with his dad and 3 brothers. Well, we hope we have a lot more memories like that, not only for John, but on the race too. John.
Thanks for that intro. Not sure who made that up, but it all sounds good. Thanks. I'll keep this short, but do ask any questions that you have. I know I'm between you and lunch at this point. The tracking is pretty much the same as last year for anyone that has done it. But for those that have not, it is included in registration. And I know you've been looking at this slide for a while. It is required for all vessels. The trackers will be picked up at the skipper's meeting. And the only thing I think they wanted to improve for any kind of drop-offs, if you're using it for the return trip, is I think there's some confusion at the guard shack where to drop it off. So I hope to improve that this year. I think the technical side, as far as the reports and everything, and how it worked, how can everybody align on the charts, worked really well. For you and for anyone observing, we do have on the Harvest Moon website, you have tracking 2022. I'll have the full feature map there available to you. We'll be using it, as Dave mentioned, for the virtual finish. And again, this is not still detailed in the SIs, but you will still need to have your own proof of finish. But we will be using the virtual finish as one of the primary sources of information. The return trip tracking, I know was not up as an option initially in the storefront. I will send out some information. So if you do want to have the tracker, you're going to sail back and you want to use it again, I'll have some information to send out in emails.
But if you don't choose that option, what's the plan for returning your tractor?
That's coming up on this. But that's a good question since you asked. It's required if you're not using it on a return trip, which has to be arranged ahead of time. Turn it in at the check-in table when you get to Port Aransas. There's a couple of forms you fill out, and one of the things to complete your check-in in Port Aransas is to return that tractor. I'm not sure what button I hit.
Go in the other direction.
This looks different than that.
Yeah, it does.
What's that?
Just go backward.
Go back.
Try the space.
Spacebar. Okay, sorry about the music.
Man, I thought you were good with technology. Why do you like that?
Nice.
I hope the tracker works better than that.
Yeah. It's like it fell asleep right there. There we go, thanks. A couple notes, what tracking is not. We've had a lot of talk about safety and your equipment, AIS for your own situational awareness, EPIRBs, personal EPIRBs.
Can you talk into the microphone?
We've had a lot of talk about AIS, EPIRBs, personal EPIRBs, DSC, all the different options that you have aboard. This is really supplemental. So there is an alert button that does operate, but all it does is send us a text saying, hey, someone hit this button. We really don't have assets. We don't have race committee boats or helicopters that can go out and help. It's really a supplemental or courtesy to say, hey, there's a problem here. Ideally, you're already in contact maybe with neighboring boats. Maybe you've already contacted Coast Guard. So it really should not be considered a primary source. But it's courtesy, so that if we say, hey, we get this alert, we can contact emergency response, say, hey, you heard from them. Maybe there's dismasking and you don't have your VHF. So it is a way to help give us more information. But again, it's not your primary source of first response. As I mentioned, the skipper's meeting on September 30th is where the pickup is. That'll be pretty straightforward. I got packets and other items for the race. Please stop by my table. I will turn these on just to make sure they're operational before you get them. Make sure they are that they do report at their location. So don't take it home. I think one time I did see one driving around Houston. There's no need for that, and all it do is potentially drain the battery. So there's no test. You can't turn it on and go look on the map because the map's not going to be active. So you won't even know if it's working really. What is important though is the morning of the start. It's in the SIs, 9 a.m. to have it turned on. And that's important so you get on the network. We can see, yep, you're in Galveston, you're in Houston, wherever your location is, and make sure that we're getting a good location. If there is any kind of issue, I'll start texting, but please turn it on at 9, and it really makes things simple, not just for me. It helps us give extra verification for the check-in team as you're coming through the jetties. Returning trackers, like Andrea asked, return at the check-in table in Port Aransas unless you've made arrangements to use it for a return trip, and in which case the guard shack here at Lakewood can receive those. Return them by Tuesday, that gives you time, really Sunday, Monday, Tuesday to get back here. Skipper's responsible for lost damage. I'm sure a lot of you have received my emails pestering about deposits. Deposits, rather than make it part of the registration itself, it's something on the side really just to make it really simpler for you so that we don't have to have charges and refunds and that kind of complexity. And then finally, operation. So if you didn't use this last year, it comes with this pouch. It's got multiple Velcro connections. It's got a bungee that's attached to it. So it's got multiple attachment points. Find a place that's out of the way. Don't put it right next to where a sheet's gonna whip it as you tack. Don't put it as a handhold where your crew's gonna grab it. Give it a view to the sky, but just find a place that's out of the way of getting kicked, pulled, hit with a sheet, etc. It'll keep it on board. So last year, we had the pouch, has a bungee with it, the Velcro, and I even gave I put a zip tie in the bag just so you can have a little extra, one more thing helping to hold it on. So you have these instructions again. It's a very simple push button operation. Some people have used spots in the past that have a button that you have to hit every 24 hours. These are, it really is just a set it and forget it. You'll turn it on, put it in the pouch, and you can use the Yellowbird app or have someone on shore check. Give it about 30 minutes to get on the network and report your position, but then you'll start seeing yourself on the map. If you have any questions or issues before or during, there's an email and my phone number's in the SIs. So feel free to contact me. Any kind of questions or issues you have as you get into this. And that's it. Thank you. Any questions?
I have a question. I registered a long time ago and got everything I did. They handed me this deposit thing, but I registered online. Didn't I already fill out that?
No, that's the deposits for the tracker. These are rental devices, and
So I need to turn this in?
yes, sir.
Okay.
If you just want to fill it out, then I'll just take the hard copy from you.
Okay.
And I just shred them at the end of it.
Thank you.
Okay.
All right, thank you.
Thank you, John. The physician formerly known as Dr. Al Poindexter, after his 80th birthday, I think he tells me that he has surrendered his license, and now he's just a retiree, raising money. Most famously, recently, at the occasion of his 80th birthday, he raised over $140,000 for the voting program here at Lakewood. We're very, very honored. He had some other stuff when he was practicing, which I'll let him tell more about, but more importantly, talk about medical emergencies at sea. Dr. Poindexter, or Al.
Thank you for that.
Thank you.
I don't know how many of you were here last year for our emergencies at sea. 1, 4, 5, 6, 7, 10 people, maybe. How many of you are physicians or dentists? Nobody? How many of you are EMTs, nurse practitioners, paramedical individuals? A couple. Okay. Well, hopefully you don't have to learn how to become one out on the open water. And fortunately, in the 40 years that I've been sailing and boating, I've never had to practice medicine. And I've just been blessed. I put out fires on board, offshore, and things like that, but I've never had to practice medicine. But however, I also know, and I need to remind you, is that when you are offshore, more than whether you're a physician or a paramedical person or whatever, more than likely you're going to be rendering first aid. And let's hope that that's all you have to do. So you really don't get a real opportunity to treat people. Mostly it's first aid. And the big decision that you have to make is that whether or not somebody needs to get off the boat or whether or not you can continue the direction in which you're going. It doesn't matter whether you're going out sailing out in the bay, or whether or not you're sailing outside the jetties, or whether or not you're crossing the Gulf or the oceans. You need to pretty much know whether or not you can get somebody off the boat. So what I'm going to do today is that I thought a lot about this in the last couple of weeks, because this is really the third time I've given this same talk. And the slides are exactly the same if you were here last year or the year before. I had one upgrade last year, and that was because of COVID. And this year, I changed the date on the heading slide. So those slides are really a good reference if you just look at them occasionally before you decide to go someplace, as to how you prepare your medicine chest, how you might take care of certain emergencies that may occur on the boat, and whether or not you need to get people off the boat. I'll try to hit the high points that I consider, and I will make another change. I just recently took a captain's course, and you're required to take a first aid course. And so I pulled out the first aid book, which is first aid, CPR, and AED standard, and is published by the American Association of Orthopedic Surgeons, which is a nice little first aid handbook. It has a lot of nice material in it, a lot of problems that you would see, and actually a lot of problems that we're going to cover, and we have slides for. But in it, it has a flow chart, the role of the first aid provider, that I thought was interesting. First of all, you have to recognize the emergency. Second, you have to decide on whether or not you need to intervene. Thirdly, before you help, you need to evaluate what the appropriate action may be. And then you need to determine what's wrong with the person. And then lastly, you need to give aid if necessary. So I thought that was a nice process to think about as you think about whether or not you need to provide some service to an individual that might need some help. Push the down button and nothing. Oh, it did happen. Okay. So what we're going to cover briefly, the medicine chest. Everybody always has questions about that. Even when I was in practice and people knew that I was a sailor, people that I saw, patients that I saw, would always ask me about the medicine chest. And I assume that everybody still does want to make sure that their medicine chest is appropriate. I won't say much about universal precautions, but you need to remember is that we now know that if you transfer fluids, body fluids, from one individual to another, you are putting yourself at significant risk for infections. So you need to protect yourself. And the easiest way to do that is with gloves. Very, very importantly, you need to know the crew. We'll talk a little bit about sunburns, seasickness, heat illnesses, trauma, which includes lacerations, burns, fractures, head injuries, fish hooks if you fish, respiratory problems, COVID-19, airway emergencies, low blood pressure, CPR, and when to call for evacuation. So let's start with the medicine chest. Well, people would always ask me for various drugs. Some of the drugs, many of the drugs I've never even heard of, but they read it in some sailing magazine that they should have in their medicine chest. And I always thought about that as a physician. So I would ask them the question, well, what allergies do your crew have? Well, I don't know. Well, what's the dose of the medicine that you're going to give that you want me to prescribe? I don't know. What are the drug interactions that you might encounter if you give a person the drug that you want me to prescribe for you to put in your medicine chest? The answer was, I don't know. So why in the heck would you want to carry a drug on your boat, in your medicine chest, when you don't know the answers to those questions? So all you're doing is setting yourself up for a potential liability issue. And the last thing that you want to be is responsible for hurting someone again. Certainly it'd be nice to have some sort of a space blanket, a thermometer, non-latex gloves, because a lot of people are latex allergic and we may or may not know about that. You can carry for pain medications, Tylenol or aspirin or ibuprofen if someone needs that. And even though I may have some drugs like that on my boat, I tell people not only bring your own drug, but these are for people that have serious injuries. These drugs are not to be given just because you have a headache. You can carry various things for infections mouthwash, eye solutions, betadine, all these things are basically over the counter. Sunburns, make sure that you cover up and prevent them, but you can certainly treat symptoms of excessive sun exposure. For seasickness, I like personally Dramamine. Usually for offshore stuff, if I was going on, I know it's going to be a rough trip across the Gulf or Harvest Moon, I would take Dramamine. Actually, by the time I left the dock. And when I woke up after leaving the jetties, I had no seasickness the rest of the trip. So a lot of people complain about Dramamine causing some sleepiness. However, it wears off, and when it does wear off, usually you're fine for the rest of the trip. So I never mind doing that. People do like, for example, scopolamine for some reason, but scopolamine, the problem is that a lot of people develop hallucinations. And the last thing I need is somebody to say that they see something on the boat that's not there. You can do, for dressings are pretty simple. Hemostasis is simple. You can get, you can have a tourniquet. You can use other things to stop bleeding. A great thing that you have on the boat is super glue for lacerations, meat tenderizer, lemon juice, vinegar, and also something for hydration, Gatorade. It did not move? It didn't move. Is that the wrong button? Down. Okay, I was told by the boss to put down. The next most important thing is that you need to know who you're taking with you. That's exceptionally important. Because guess who's responsible on the boat? Even if I do go with you and I am the retired doctor on board, who's the responsible person? It's the skipper. Always it's the skipper. The buck stops with him. And if you're the skipper, you need to know that, and you need to know who you're taking with you. You need to know their capabilities, but you also need to know any medical issues that they may have that may be affected by the trip, or their medical condition may affect your ability to go through the trip. So that means that they have any infections that are important. It's not impractical to take someone aside if you need to ask those kinds of personal questions. You need to know if they have severe allergies, chronic diseases, asthma, diabetes, seizure disorders, recent surgery, or hospitalizations. Because you should make the decision as to whether or not they should or should not go. I like to require crew to bring their own medications because I don't want to be the provider of those medicines. One is I may not be able to get them, I may not know the doses, I may not know the brands. There's so many things you don't necessarily know. So if they need insulin, if they need aspirin, if they need anticoagulants, if they need an EpiPen, nitroglycerin for chest pain, or seasickness medication, bring your own. Very, very important. So the crew has responsibility too. It's the same thing. They need to know what illnesses they have. They need to know whether or not they can do this trip. I've been across the Gulf now, I think close to 7 times, in both directions, north and south, east and west. And some of those trips, all those trips have been at least 5 days, And you never know what's going to happen in that 5-day period of time. So they need to understand their issues as it relates to a potential passage that they want to take across the country. We've already talked about universal precautions, wear gloves if you're going to interact with bodily fluids, sunburns, protect yourself, that way you don't have to worry about them. Pain associated with them, you can give medications for that. And I think that the most important thing that you need to know is that leave the blisters intact. Nausea, vomiting, seasickness. The important thing that you need to remember about this is that people, when they're seasick, not only put themselves at risk, but they put the crew at risk. Mainly because of the fact that they want to always chum over the rail. And how many people will fall overboard as a result of that? It's not uncommon. We've talked about ways to prevent seasickness. I like Dramamine, others like other things, but there's a list, a whole list there, as you can imagine. Heat stroke, there are reasons that people are at risk for it. Hydration's probably the most important part. And one thing that we don't want to hydrate with is what? Alcohol. And that's what sailors love to do. Right. When people have heat stroke and temperatures of 101, they will usually start having seizures. They will usually lose the ability to perspire. They will become delirious. They will become unconscious. They will develop organ failure, and you need to get them to the hospital immediately. That's the reason to evacuate. And we're going to talk a little bit more about evacuation at the very end. For trauma, if it's a simple laceration, stop the bleeding, cleans the wound. And if you can super glue it, which will always help hold it together and it'll close up easily. Burns. Thank goodness we've had fires, I've had fires on board, but we've never had any burns associated with it. But a 3rd-degree burn is another reason for an evacuation. It's not uncommon to have 1st or 2nd-degree burns. A 3rd-degree burn is a reason to get a person off the boat. Fractures, it happens. You fall, boat's moving all the time, you fall on your wrist, you fall, you get hit by the boom. So there are reasons that fractures do occur. It's the open fracture that's the problem. Remember to stabilize any extremity or whatever that you think that there's a fracture in. You can do it a lot of different ways. You can do it with 2 life jackets taped together. You can do immobilized extremities many ways. However, if there's bleeding associated with it, stop the bleeding, but get them off the boat. Head injuries. Well, we get hit a lot of times. I remember once I was sailing doing a regatta, and I guess I'm going to excuse it and say I was very inexperienced. Sailing an Ocean 30, which I thought was a little much maybe for me, even though I was much younger at the time. And I had an accidental jibe, and the boom came across and hit me on this side, and it obviously knocked me over to this side. And then as a result of that, the tiller went the other way, and the boom came back and hit me the other side. Now, I didn't lose consciousness, but the fact is that we do have head injuries frequently, And when they happen, if there's confusion, if there's loss of consciousness, if there's nausea, vomiting, then there's a concussion and you need to get those people out. Fishing we like to do. COVID-19 is around, and it's going to be around for a long time. You're seeing mutations of the virus almost on a weekly basis, it seems like. But you know the symptoms, you know, runny nose, fever, cough, and so on and so on. And obviously there's a quarantine period that needs to go with that. And your crew needs to tell you that they're infected, but you also need to recognize the symptoms and try to get them, not let them go, and try to get them care if they need to get off the boat. But hopefully they won't be going at all. But it's not to say that people won't show up with symptoms. And it's not likely that's going to happen with Harvest Moon, but it could easily happen if you're going on a significant passage. Chest pain, the thing with chest pain, most times it's from maybe drinking too much and you have esophagitis, inflammation of your esophagus, and if you can take an antacid and it goes away, good. But what if it doesn't go away? Then it could be some other problem. It could be a pulmonary embolus, which is life-threatening. It could be pleural infection, which is not life-threatening in most cases. It could be a heart attack. It could be a lot of things like that. So, fortunately, you will pretty much have a better idea if you ask about other symptoms. And the classic symptom is that a person says they have this elephant sitting in their chest, this crushing chest pain. Now, women will have different symptoms than men do. Men usually have radiation of pain down their arm. Women will have radiation of pain up their jaw. So there are differences in symptoms, men and women. But if you think there's a heart attack, you need to get them off the boat. Well, aspiration of food happens. I'm sure you're going to eat between here and Port Aransas. So you have to be concerned about obstructions. And everybody knows how to clear a throat with that where there's choking involved. And you know the universal sign of choking. And if they're choking, more than likely, and they have an obstruction, they will not be able to voice that. So you'll figure it out pretty fast. Well, we talked a little bit about drowning, but the main thing that you know about drowning, seawater is worse than freshwater drownings, and that those people need to be evacuated, where a person has been resuscitated from drowning. So I guess I should have talked about this, said something about that one. If you have problems with low blood pressure, as you would with maybe heart disease or heart failure, or the heart failing to work properly, then obviously those people need to be evacuated. And you need to try to increase the fluid or the volume of blood to the brain to protect the brain, so you need to put them in reverse Trendelenburg to elevate the legs so that they will increase the blood flow to the brain to protect the brain. CPR, I think that that's probably a skill that we all need to know about if you're going offshore. And it's pretty simple. It's hard to do. I mean, I've struggled with that over the years, but it's pretty simple to do. Make sure that you hyperextend the head so that the trachea is open or straight. and then you compress, make sure that you compress the chest at least 2 inches for 30 compressions, and then 2 breaths, and then repeat. The key is that it doesn't take long to get tired when you're doing CPR. So you need help. Ideally, if you're onshore, somebody needs to call 911. If you're offshore, then you're going to need somebody else to also relieve you and try to get them again off the boat somehow. Skin infections, the only reason I showed this one because everybody likes to look at this right after they eat. It's skin infections, particularly in the lake, where you have a lot of contamination or with flesh-eating bacteria are bad. And they are deadly. As a matter of fact, fortunately, in the 45 years that I practiced medicine, I only had one patient that had a flesh-eating bacteria. And she had 17 operations inside of her mouth. They are vicious. These are some pictures. This is not my patient, of course, but these are some pictures that I pulled off the web of these kinds of infections. And this this flesh-eating bacteria, probably strep. In this particular case, a person was going to lose their leg over it. But thank goodness they got it cleared up before it was taken off. So we always have to remember where we are when evacuations have to occur. And obviously, if you can call 911, great, that helps. Obviously, the radio is a benefit if you're too far away for phone service, but you need to find a hospital facility or emergency facility. You heard the Coast Guard this morning talk about assets being deployed to help out. And you have to remember where those are and the range that people have. Helicopters have about 150, as I understand, 150-mile range, but they have to get back. So they can fly probably 300 miles. Now, the helicopter services, to my knowledge, are in Ellington and Corpus. If you're talking about vessel, Coast Guard vessel, then you're talking about coming out of Galveston, Port O'Connor, Corpus, Freeport, or Port Aransas. Either way, vessel or helicopter, you're talking about hours. So if you have to evacuate, it takes time. And you always need to give that some consideration as you deal with the problem that may have occurred. So just to repeat, what are the reasons why you want to get people off the boat? Stroke, third-degree burns, compound fractures, numbness in blue extremities, head injuries, suspected heart attacks, severe asthma attack or severe allergies, drownings, seizures, CPR, and it's not likely that you're going to think it's a flesh-eating bacteria for a short trip, but maybe on the long passage, you may think that this is some progressive infection, that there may be a flesh-eating bacteria. So those are the reasons that you need to think about evacuation. This is a nice handbook that's available through Amazon. This is another handbook that's available through Amazon for $18. So it's nice to have a reference book available for you. You can keep the slide deck printed out and use it as a reference. It won't tell you a whole lot about treatment, but it tells you what are the things that you need to be mindful of. So with that, I'm happy to address some questions if there are some.
Does that mean you dropped your insurance with your license?
I have turned it in. But, no, I mean, you know, when there are emergencies on board, you take people that are willing to try to help out. Because you never know what it's gonna be, and it's not to say that the healthcare worker is the most experienced person to deal with it.
Okay.
No other questions? Well, thank you.